In this study, we included a total of 220 patients who had received radium between 2013 to 2017. And really what we wanted to look at was the characteristics of those patients who had received radium pre-chemotherapy versus post-chemotherapy. About half of our patients had received radium pre and half post-chemotherapy on average. And what we showed was actually that when Radium-223 was given prior to chemotherapy, it did not actually influence the amount of chemotherapy that any individual patient could receive. There's been some data to say that, well, maybe if you give radium pre-chemo, their counts may not be sustained, or they may have reasons for them to not actually receive all cycles of chemotherapy. And what we actually demonstrated in our data was the median number of chemotherapy cycles given when radium was given either pre or post chemotherapy was 9 for both groups, and it did not seem that radium actually affected how much chemotherapy any one patient was able to receive. The other thing that we actually showed was that if radium was given pre-chemotherapy as opposed to post-chemotherapy, it was more likely that any individual patient would actually be able to complete all 6 cycles of Radium-223. It's given IV every 4 weeks for up to 6 doses, and it was more likely for a patient to complete all 6 cycles if radium had been given first and chemotherapy given second.